Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you. So on today's class, where we'll be looking at topic 4, prevention and control of non-communicable diseases. That's what we'll be looking at on today's class. We've talked about concepts of non-communicable diseases. We've talked about the etiology, prevention, epidemiology, and predisposing factors to non-communicable disease in our previous lectures. So on today's particular class, we'll be looking at prevention and control of non-communicable diseases. At the end of this lesson, we should know how to apply the concept of modifiable factors in the prevention of non-communicable disease, and then understand the different preventive measures used in common non-communicable diseases. So, what are the concepts of prevention of non-communicable diseases? Usually, in non-communicable diseases prevention, we'll try to look at those factors that we have control over, and they are usually called modifiable factors. Usually in prevention of non-communicable disease, there are two aspects: the modifiable factors and the non-modifiable factors. Now, the non-modifiable factors are genetic factors, and some environmental factors that we don't have control over, but mainly the genetic factors. So the one we have control over is the modifiable factors, and in that, in those factors, we look at exercise, we look at diet, we look at smoking, and we look at alcohol. So we will look at how to control specific diseases or specific conditions. Remember, we talked about the 4 common non-communicable diseases based on the number of morbidity and mortality which they cause globally, and we've been focused on heart diseases, chronic respiratory diseases, cancer, and diabetes. So we will apply the control measures for each of these diseases mentioned in our subsequent slides. However, in the next slide, we'll have an activity. I want you to take a look at it before we continue. So, activity 1, what are the modifiable measures in the control of cardiovascular diseases, that's CVDs? So the control measures for cardiovascular diseases, example of cardiovascular disease, you can have what we call hypertension and coronary heart diseases. That's what I represented as HPN and CHD, hypertension and coronary heart diseases. People are usually told to watch their diet, and in watching your diet, you should reduce salt intake and reduce excessive fats and oil in your diet by taking healthy fats and oil. The essence of that is to lower the bad fats in your blood, which actually could predispose you to having cardiovascular diseases. And those bad fats are the cholesterol, the triglycerides, and the low density lipoproteins, as well as other saturated fats in the diet. You are also asked to reduce weight. If you're overweight or tending towards overweight, you should reduce weight. That would also help. Diet, of course, will control your weight. Then alcohol, those modifiable factors, diet, alcohol, those things you have control over. Reduce the quantity of alcohol you take and also the quality. Some alcohol might contain more calories than others. So when you look at all that, you factor the quantity and the quality of the alcohol you take. Stop smoking entirely if that is possible. If you're not exercising, you exercise because that helps in cardiac function. The more you increase the flow of blood into your heart, and that improves your cardiac function and improves the pumping of blood to other parts of the body. You should try to relax. That helps in improving your overall health. And when you sleep and then you're stress-free, that also helps in relaxation. So cancers also has to do with your diet. Control of cancers has to do with your diet. Try to take more of vegetables and fruits. Like we said, smoking also has a kind of a risk factor to cancers. Women who are already having children, the number of children and that they have exposes them to cervical cancers, and the cause of cervical cancer, which is the human papillomavirus. Your work environment and protective equipment, like people who work in asbestos companies, people who work in coal mining, and exposure to co-workers' pneumoconiosis, who work in the dye industry, plastic industries. Those are carcinogenic agents which can expose one or make one have risk of having cancer. Workers in the radiation places. So that is the aspect of what we call the physical environment and its impact in health or impact in non-communicable diseases. So when you properly place people in the work environment and give them protective equipment, you help to prevent some of these non-communicable diseases. So chronic respiratory disease, examples like asthma, chronic bronchitis, such can also be prevented when you stop smoking entirely, you're not exposed to dust, fumes, smoke, allergens and pollens in the air, and other pollutants which are physical environment related. Job placement for people who are prone to having allergies and all that can also help prevent them from coming down with attacks of asthma and coming down with chronic bronchitis. In the next slide, we'll be having an activity. I want you to take a look at it before we continue. So activity 2, what are the modifiable measures in the control of diabetes? So diabetes, the modifiable factors, those things you have control over in the control of diabetes, you reduce sugar intake, especially these days that you don't even know those who have family history of diabetes or not. Sugar, excess sugar and excess calories should go down in one's diet, on one's daily consumptions. You should try to take more of vegetables and fruits and also reduce weight. Alcohol, like we said before, the quantity versus quality of the alcohol you take. Stop smoking entirely if possible, and then exercise helps cardiac function. And then we should try to relax, have good sleep, and then be stress-free. Those are the things that can help control diabetes. So, what are the roles of other bodies in the prevention of non-communicable diseases? Like you have government, you have non-governmental organizations, international organizations. What do they do? Usually they try in creating awareness. Government, of course, will produce legislations, public health laws, and even enforce and improve the social determinants of health in the population. Legislations like probably increasing the cost of cigarettes, or even banning importation of cigarettes. That can also help to reduce smoking. Then alcohol, increasing prices in alcohol, and other factors, public health laws that also help, occupational laws that also help to, um, you know, proper recruitment of people in work environments and protection of people who work in dust, fumes, and smoke industries will also help to protect them and prevent risks to these non-communicable conditions or diseases. So some have learned what modifiable factors are in the prevention of non-communicable diseases. We also know specific control measures for those common non-communicable diseases I've mentioned. So in our next lecture, we will continue with prevention and control of non-communicable diseases. Thank you so much for listening.